Good morning, everybody. Welcome to the annual public meeting of Lincolnshire Partnership NHS Foundation Trust. My name's Kevin Nokia, I'm the Trust Chair. It's absolutely fantastic to see so many people here this morning. It's also fantastic because this is the first in-person APM that I've been involved in. I think it's the first in-person APM since 2019, which is fantastic. So if it all goes horribly wrong, it's because we're out of practice. I've got to start with the normal boring housekeeping stuff. So no one's planning to set fire to anything, so there aren't any fire alarms planned for this morning. But if there is one, please follow the events team to the nearest exit and congregate in the corner of the car park. There are some toilets in the building. There's a map, I think, in the programme to show you where they are if you haven't already found them. And please, it's a no smoking site, so if you need to smoke, go as far away from the site as you can, I think is the general advice. We're live streaming these presentations to all the rooms in the building, so you don't need to come to where I am to see it. And a full recording will be available after the event on the Trust website. So I've got some formal stuff to do at the beginning in a few minutes, signing minutes of the last meeting and things like that. And I'm going to just do some general offer some general comments on what's been happening in the Trust over the last year, some highlights for me from the last year in the Trust, and then I'll hand over to Sarah, Chief Executive, and other members of the exec team who will be adding some more detail around some of the things that I might touch on. If you've got questions at any point, then please ask them after each of the presentations rather than saving them up until the end. And I know my colleagues will be happy to take questions. After that, we'll close the public part of the meeting and move to our members' meeting. It's technically for members only, but we're happy for any non-members to stay and maybe consider becoming a member of the Trust. Be delighted if you did. As I say, there'll be an opportunity for questions all the way through this, and please ask them if you've got any. Please feel free to wander around the many stalls we've got highlighting the great things that the Trust is doing. And you're more than welcome to hang around and go and look at those. So let me offer you some brief personal reflections on the last year. This is not intended in any way to be comprehensive. There will be things I don't mention. Exec colleagues and Sarah will probably mention those. And there are some things that I'll give particular emphasis to because they're personally important to me. So as a Trust, we're on a journey. We continue to be on a journey, one with a destination I suspect that we'll never arrive at. The way that we deliver our services has changed in the last few years. That it will continue to change. Demand for our services has increased, and it will probably continue to increase. And the nature of that demand has changed. The profile of our patients and service users continues to change. That's why we continue to work with our service users, with families, with carers and our staff to change and adapt our care for the future. Just as our demand, our environment doesn't change, we're determined not to. It doesn't stay still. We're determined not to either. Demand in our children and young people services is particularly significant, and we recognise that there's a real need to intervene early to try to prevent further deterioration in mental health and well-being, and to ensure that people don't unnecessarily be dragged in, as it were, to services when we can divert them earlier on. So that's important to us. And although we know our waiting times in children and young people services are higher than we want them to be, we are making progress in reducing them. For example, introducing new services in schools and offering all-access telephone helpline. And we're working with our partners in the wider Lincolnshire health and care system to start a significant review of the services we provide to children and young people and their families. in order to transform our offer for the future. And you'll hear much more about this from the service lead later this morning. But we know, and we continue to be concerned about the fact that our capacity, isn't meeting demand across all of our services. We know, as I've said, that our waiting times are higher in some areas than we'd like them to be. So in this context, we've got clear plans for recruitment and for service transformation with further investment that will help to improve access. Some of that won't happen as quickly as we'd like, but we're determined, and I'll mention our trust strategy in a moment, to make sure that we adapt, transform our services and recruit staff to make sure that we have the capacity that we need. We've made really great progress on recruitment over the last year, and you'll hear much more about that from our Chief People Officer, Amy Beaton, later this morning, but I'd like to take this opportunity to thank her and her team for absolutely transforming the way in which we've recruited people over the last year, and to put us into a position which, when I became chair 3 years ago, I never imagined we'd be in. So thank you very much for that, Amy. I'll move on then to some particular highlights for the year. There's a lot, it's a challenging environment that we operate in. As I say, our demand has increased. No one's going to arrive with big buckets of extra money for us anytime soon, I don't think. So it remains challenging. But even in that context, there's lots that we should celebrate from the last year. We've introduced some really important new services and support, and with more mental health support in schools, a new virtual autism hub, a Macmillan Cancer Support Service for those who are struggling with cancer diagnoses, new mental health roles in primary care, children and young people workers in hospitals and emergency departments, and enhanced aftercare after custody, the Reconnect service, something that I'm particularly interested in because I've got a professional background in that sort of work. So I understand how difficult it is for people to make the transition from prison back into the community. We also continue to improve our crisis offer. The successful mental health urgent assessment centre in Lincoln is moving to become a service available to all ages. This has been further supported by the new NHS 111 mental health service, which gives callers the opportunity to speak directly with local mental health professionals for advice and support when in crisis from a, I hope, easy to remember number. And we've also worked with voluntary community faith and social enterprise sector and continue to work with the sector in the community transformation programme, which you'll hear more about later. And I'm also really pleased that only yesterday we were awarded the People's Choice Award at the National Lived Experience Awards for the work of our patient partners. So if you want to know more about that, I'm particularly delighted about it. If you want to know more about that, Lou and Millie have got a stand in one of the other rooms, so I strongly urge you to go and have a look at that and talk to them. We've built some new wards, which I'm really, really excited about. Really pleased that we have got 2 new wards in Lincoln, but I'm even more pleased that we've now broken ground and started to lay the first bricks for our new £40 million ward in Boston at Norton Lee. I make no secret of the fact that I live 5 miles away from Boston. Boston is my local town. I've got a lot of personal investment in Boston. My son goes to school in Boston. It's really important to me that we work as a trust to develop parity of service, parity of access in the east of the county. And so being able to go along the other day to take part in the Golden Trowel ceremony at Norton Lee was fantastically important to me, and it's just if nothing else happens in the 2.5 years I've got left as chair, then that will do me. Thank you. I'm also delighted that as part of that process of developing the new wards, our service user engagement in the design of them has been recognised through the 2023 Design and Mental Health Awards. I think the way in which we've engaged staff, service users, in the way in which we've designed those wards, hopefully, it's impressive of itself, but I hope it will make a real difference to the experience of patients that use those services. We've had some changes at board level. We've said goodbye to Anita Lewin, Director of Nursing AHPs and Quality, and welcome Sharon Harvey as our new Chief Nursing Officer. I can't call you new Chief Nursing Officer anymore, can I? But as our Chief Nursing Officer. Jenna Davis, our Director of Corporate Governance, has gone on to Convent to support a neighbouring trust. In the light of that, we've taken the opportunity to look at the mix of skills and competencies we need at board level and to sharpen our focus on transformation, both within the trust and how we link into the wider Lincolnshire system. So Chris Higgins, Director of Operations, has stepped across into the role of Chief Transformation Officer on an interim basis, and we wish him the best of luck with that. And Eve Baird has stepped up from a previous role as lead for one of our clinical divisions to act as Ops Director, not Ops Director. I need to get my language right. As Chief Operating Officer. In addition to those changes, on the 4th of December, Dr. Kaval Patel was appointed as an Associate Non-Executive Director for a term of 1 year. 1st of January this year, VJ Luthra commenced a placement in the Trust as part of an NHS England scheme called the Next Director Scheme, again as an Associate Non-Executive Director. On the 1st of February this year, Sarah Whiteman was appointed as a Non-Executive Director for a term of 3 years, and we welcome all of those. We mentioned at last year's APM that the Trust was developing a new 5-year strategy, and at that point it was near final sign-off. It has now been signed off. I don't mention this because we've produced a glossy document and you can get a copy and stick it on a bookshelf somewhere. I mention this because it is going to be the plan that articulates everything that we try to do as a board and as a trust over the next 5 years. It is our way of delivering our underlying vision, which is to support people to live well in their communities. And we set out really clear set of strategies and approaches that we think will enable us to do that as well as we can. You can test whether or not we're making progress on that in a year's time. By then, we will have a full set of delivery plans across all of our services to live up to that strategy and deliver the priorities in that strategy. And in a year's time, let's see how far we've gone. You'll see through this morning's presentations and by looking at the stalls in other rooms, that we've got lots to be proud of. We've got some fantastic services and some absolutely incredible staff delivering really important work to service users, patients, families, and carers. But we also know that there's loads more that we can do. We can always reach further, and we can always do better. We know how important it is to get the right mental health and well-being support in place across our communities. And our strategy sets out how we're going to try to do that. Now, as I say, if there are questions on any of this during the course of these presentations, then please feel free to ask them. That's the end of my general introduction. That you'll hear lots more from Sarah and exec colleagues on the detail of all of that. I'm going to end by saying one thing. It's a privilege to be chair of such a fantastic organisation. It's a fantastic organisation not because we always get things right, but because we recognise when we get things wrong and we recognise when we can improve. That, for me, is the test of a great organisation, not one that pretends it's infallible, not one that pretends it's always right. We try to learn, we reflect, we have difficult conversations as a board to try to get these things right. And that's what makes me proud, I think, is the fact that we're able to criticise ourselves and be as reflective as we are. And hopefully that will come across again during the course of this morning's presentations. So I've got to do something that I've never done in public before, and that is sign a set of minutes. as I've done it in the past online, but I do have to ask if members and so on present are happy for me to sign minutes of the last meeting, which are on your chairs, and I'm sure you've read them all avidly. But if anybody's got any reason why I shouldn't sign them, then do please shout, and I won't. I'll take that sneeze as a sign of... so I will sign those minutes and remind myself what the date is. So having done that, I will hand over to Sarah Connery, Chief Executive. Thank you very much. Thank you, Sarah.
Thank you very much, Kevin, and welcome everybody. Thank you very much for joining us today at this event, and thank you as well to all our fabulous staff and volunteers and patient partners who are manning the stalls as well. So, you know, really using your voice to promote all the great stuff that you do in each and every day. And indeed, a massive thank you to all of our staff for all of the great things that they achieve, as Kevin says, for our patients and service users and families and carers. So I'm just going to talk a little bit about our activity here at the Trust, as well as our performance over the past financial year, 22, 23, 24, just get it right. It's been a few years since I've been here in this room, and the last time I was up here I was the Director of Finance, so this is a bit of a change for me. But as Kevin says, I'm absolutely privileged to be Chief Executive of this fantastic organisation. We don't always get things right, but I really like the progress, not perfection moniker on the wall there. I think that's maybe my theme for today is, you know, we're moving forward day by day. We might not ever reach our destination, but we'll all strive together to try and get there as much as we can. I'll also talk a little bit about the performance of the Trust as well. But I do say, if you'd like to go into a bit more granular detail on some of those elements, we have a fantastic annual report that members of the Trust have built up. So please do have a look if you want a bit more detail on some of our performance aspects as well. So Kevin talked a lot about how demand is increasing for our services, and I think it's important to just talk about the shape of the Trust in terms of the activity that's coming through our door as such. So there's a few statistics there in terms of the numbers that are coming through. And at any one point in time, we have about 53,000 service users on our electronic patient records. So that gives you a feel, hopefully, for how busy we are. We haven't got the right demand and capacity aligned in certain teams, but that's something that we're striving to get right through our new Trust strategy and the work that Chris will be doing as our Chief Transformation Officer. So in terms of our performance, I'm delighted that through the financial year we remained it's called NOF 1, which is National Oversight Framework 1, which is a way that NHS England segments providers according to their performance across a range of different indicators. So I'm pleased to say that we're 1, and that is the best. So it's out of 4, and we remained at number 1. We are part of the wider Lincolnshire system, which was, as a system, we got rated as a 4, which is the worst that it can be, but I'm delighted that through the financial year we managed to pull ourselves working together in an integrated way into oversight level 3, and we're striving to get to 2 and 1 as we go forward with our plans taking us forward over the next few years. In terms of waiting times, as Kevin has said, that we're not quite there yet in terms of making sure that we are getting the access right when people need our services, but it is a really improving picture. So we've still got challenges, but our focus remains robustly on tackling these waits, ensuring that we're seeing people with the greatest needs most urgently, and ensuring that we're in regular contact with those people who are waiting to ensure that their needs have not changed and provide signposting and resources where it's most appropriate. And as I said, further transformation of those services will help us to tackle those waiting lists. Significant work's taken place over the last year to tackle improved waiting times for children and young people. And Lincolnshire has got a successful model of prevention and early intervention, working with our local authority colleagues to make sure that we've got access through schools and in those communities to really prevent emotional wellbeing concerns escalating into mental health conditions. So significant improvements have been made in this following some significant investment, and we've seen a reduction in the number of young people waiting over 12 weeks for treatment from 283 people in February 22 to 130 people in February 24. So that's a reduction of 54%, and a massive thank you to our children and young people's teams for all the work that they've done there. Anyone waiting for services has contact at least once a month from a member of the Children and Young People's team to monitor any change and make sure that people have got access to those self-help resources. We've now got most people waiting less than 4 weeks for a routine referral for our eating disorder services. And in terms of our benchmarks, we do benchmark really positively against our Midlands colleagues as well as nationally as well. In terms of access, we continue to see growing numbers of people accessing our services, particularly across community mental health transformation work, as well as talking therapies and perinatal. So we didn't actually hit the national targets that were set for us in 23-24, but it was an improving position through the year, and we are now, in this financial year, achieving most of those access targets. Our recovery rate for those accessing talking therapies remains really strong, in line with the target of 50%, and more than 80% of people received a follow-up contact within 72 hours of being discharged from one of our wards. Our early intervention and psychosis team have done a phenomenal job from pulling through our performance now, and we're overachieving on the national target there and have been for some time. In terms of autism assessment weights, that's an area of significant increased demand. And again, the team have done an absolutely phenomenal job and reduced the waiting time by 40% across the year, with a median waiting time now of only 11 weeks, which is really positive when we benchmark regionally and nationally. In terms of out of area, we had done some great work in terms of getting our numbers down as low as possible, and we are seeing that creeping up again this year, but we've got a really detailed plan to pull it back in line. Again, we need to make sure that we've got the right capacity in the right areas to meet that meeting demand, but it's certainly an area of focus for our Trust Board. In terms of financial challenges, I don't think there's an area of the NHS which isn't suffering from financial challenges at the minute, but we do work really closely with our system colleagues to make sure that we're using our resources effectively as possible, and it is something that the board takes very seriously in terms of making sure we're living within our means to do as best as we can with those resources that we have. I won't talk too much about reducing vacancies because I don't want to steal Amy's thunder from later on, but it is an improving position and quite significantly so. So I'll leave it there, and we'll be handing over to Amy shortly. In terms of our information and data, so we're getting much better at making sure we're measuring the right things. So it's not just about how many people are coming through our front door, but are they having a positive experience? And are our staff having a positive experience as well? So if you look at our integrated performance report, you'll see some more indicators are greyed out because there's things that we want to measure, but we just haven't got the systems right at the minute to be able to measure them. But that's something that we'll be taking through our trust strategy this year. In terms of changes to services, following formal consultation, so we've now approved the permanent closure of Ashley House in Grantham to enable our full county-wide rollout of community rehabilitation. So something that's really important to me, and Kevin has touched on it, to make sure that we don't have any postcode lotteries here in Lincolnshire for the services that we provide. And now we're looking at future uses for Ashley going forward as well. We've further extended the closure of Manthorpe Ward in Grantham to further expand our pilot of dementia home treatment team for a further 12 months. And we've just received our East Midlands NHSE Clinical Senate review of that. Really great feedback from service users and their carers and family. So watch this space, and we'll be reporting back on that next year. We did have to take the very difficult decision to have an emergency closure of our PQ unit, that psychiatric intensive care unit at the Hearts Home Centre in Lincoln. It was due to significant staffing pressures across all of our inpatient wards. And then after that, we had some issues around Legionella. So it was closed longer than we would like it to, but really pleased that we were able to open that in June of this year. And a big shout out to the team who've done a phenomenal job in terms of keeping connected and making sure that as soon as we were open, we're ready to deliver those very important services again. In terms of partnership working, I like to sort of lump it into three sort of areas. So we have our Lincolnshire Integrated Care System working. So this is how we're trying to integrate care between physical and mental health as much as possible. So Kevin talked our work with Macmillan around psychology for people living with a cancer diagnosis, our interface work with primary care colleagues. We work together very closely with our other organisations around capital and revenue, again making sure that we're using the best of our resources where we can around data and digital, and estates utilisation as well. So very much trying to see ourselves as one NHS where it makes sense to do so. We also have our Mental Health, Dementia, Learning Disability and Autism Alliance. So that's an alliance that I chair, where we come together with local authorities, with district councils, primary care colleagues, the police, VCSE sector, to try and come together around what are the outcomes that glue us all together, that we're all trying to achieve in terms of ultimately trying to do ourselves out of a job in terms of reducing the number of people who need to access our services, working together around housing, employment, those social determinants of health, and making sure that people feel really well connected in their communities, which is part of people's recovery journey. We also work across a 5 million population footprint as part of the East Midlands Mental Health and Learning Disability Alliance. So that's us and 5 other trusts across the patch coming together around common problems. So we do work really closely together around specialist services. So forensic services, for example, adult eating disorders. So we come together to make sure we've got as seamless pathways as possible across that footprint, but we also come together around significant shared challenges such as recruitment, skills development, for example. So lots of work going on in that space there as well. So I think my time is up, but I will open up to any comments or questions that people might have. We have a roving mic. Okay, I don't see any hands, so I'm delighted now to hand over to our Chief People Officer, Amy Beaton. Give you the magic clicker.
Thank you. So, as Sarah said, I'm Amy Beaton, Chief People Officer. This is my first face-to-face. And therefore, if my mic cuts out and you can't hear me, that will be Joe at the back there, because I've not kept for my 5-minute brief, which is a challenge for me. I better get going, and I would like to start by reflecting on how we've said it feels like to work at the Trust through our National Staff Survey 2023. And the reason I wanted to start with that is because our staff are our greatest asset. Absolutely. We know that if staff can be the best version of themselves at work, they're going to bring the most hopeful and high quality care. So in our National Staff Survey 2023, we saw some really heartening improvements. Not only did we hear more from us, so 6% rise, nearly hit 60%. You will see this people promise, and there's 7 domains here, and that's how the National Staff Survey measure our results. And there's 30 subsections under those 7 domains, and we improved in every single one of them compared to our 2022 position. And I know, and I'm often told, benchmarking is not the be-all and end-all, and it's not. We've got our own ambitions in this space. But but we also benchmarked well above the national average when you compared us to our peers and when you compared us with all NHS providers. And in 2 of those, we are recognised and rewarded, and we are a team. We scored the highest, or joint highest, but the highest nationally compared to 217 NHS providers. You can tell I'm really proud about this, can't you? That said, we are not resting on our laurels, and there were absolutely areas in that staff survey where we need to improve, and you will therefore see some real focus on that in 2024, and I will come on to that. So in 2023, we had our people strategy, which we worked to, and we organised our annual priorities under those 4 pillars that you can see. And I am not going to do the teams justice in the time I've been selected. Can I have 30 minutes next time, Joe? So I'm leaving these stats on the slide for you to look at while I talk about. And this first one is our recruiting pillar, and you'll see the efforts of our attraction, marketing and recruitment efforts in this space. So I'm just going to pull out a few. Time to hire. So back in 2022, we halved our time to hire, and we sustained it throughout the whole of 2023. And so we were in the top 3 nationally when you compared us with other organisations that use the same recruitment system, which was 192. So we were in the top 3 throughout the whole of that year, which means we're getting people in faster. We are filling those vacancies quicker so that we can deliver the best possible care. And although we've done lots nationally, internationally with our recruitment, we wanted to recruit more from the communities we serve. So we know we want to have an impact on our communities, as Kevin said. We want to employ more people from our communities. We know that if people have purpose, that if people have finances, that really impacts their mental health and well-being. So we've been getting out and about in our community. We've been, teams have been in schools, they've been in colleges, universities, we've been piggybacking into community events, getting our stands up and talking to people. We've organised bespoke recruitment events for our harder to recruit services. And we've also widened our advertising in our community. So we're really pushed this out, and hopefully you will have seen our work and maybe your own faces or your colleagues' faces in our train stations, in our, bus stations, buses, petrol pumps, maybe even when you're watching the footy, actually. And all of this, as Sarah said, so I'm pleased you didn't steal my thunder, has led to an impressive reduction in our vacancy rate. So you can see what we were at the start in 23 and what we were at the end. And we increased the number of staff in post in 2023 by double what we've ever achieved in the previous 5 years. We know that's not always felt in every service, and I want to say we are really continuing to drive our improvements in that space. In our valuing pillar, so we want all of our staff to feel like they belong at LPFT. Hopefully you will have seen our work around that, and particularly in our staff harm programme. In 2023, we did see through the National Staff Survey results some impressive reductions. We saw a 12% reduction patient to staff and a 9% reduction staff to staff around bullying, harassment and abuse. But other metrics didn't move. Discrimination stayed quite static. And we also heard from staff experiencing some of the incidents that we weren't always getting the support to them right. And so that's why we've listened, and you will have hopefully seen the comms in 2024 that have been coming out regularly where we're really focusing in this area. So improvement, but still recognising more to do. Our staff networks, wow, they've been supporting us with some key work streams, burnout, reasonable adjustments, return to work toolkits, working with our equality, diversity and inclusion teams to run conferences and events. Our women's conference sold out in 2 hours. Real good. On all of this to support generating that inclusive culture that we're really trying to achieve here at LPFT. And we also welcomed a new staff network, our Neurodiversity Network, in July 23. Oh, we're doing so much in this space and I'm not going to do it justice, so please talk to me after. But I'm going to focus in on the Internationally Educated Nurses Development Programme. We got NHS England funding to run this, to really help our colleagues in that space be able to move into more senior roles. We've just completed our cohort 1, 8 delegates, 6 have already gone on to achieve promotion into senior roles, and cite that programme as being instrumental in supporting them to do that. And then finally, retaining. So lots in this space. We've got a People Promise Manager that got recruited, funded again through NHS England, really focusing on pushing in this space. Some really great achievements here. Team rostering, we've been rolling out since 2022. We've done an evaluation of those that it's been in 22 and 23, and we've seen some really impressive reductions in sickness and turnover in some of those areas, but in all of them, the pie chart with the big overwhelming section on it was those that felt that it's led to better work-life balance. So in 2024, we're pushing that out further, including into community. And therefore, what we've seen as a result of all that work is our turnover reduce as well. I haven't put a nice chart on, but we started in the financial year in 23 at just over 13%, and by March 24 we'd got that down to just over 10%, and we have sustained that so far in 2024. So that's it from me. I mean, that has been a whistle. Joe's like, you know, champion me at the back there. That has been a whistle-stop tour. So, you know, please speak to me. I'm renowned for talking. I do like to talk, but I also really like to listen more. So please come and talk to me if you want to go into anything in more depth. I'm really honoured to be here as Chief People Officer, and I'm really proud of the psychological safety we create as a trust to enable us to talk honestly with each other. So please keep talking to me and I'll keep talking to you. And so does anybody have any questions before I hand over to Sharon Harvey, our Chief Nursing Officer? No?
Thank you. Been taught how to use this, so that's good. Thanks, Amy. Hi, everyone. I'm Sharon Harvey, so I'm the Chief Nurse here at LPFT. And again, same as others, it's the first time I've presented in the annual public meeting face-to-face. And it's been really hard to know which bits to put in the slides and which bits to cover. So, and with the help from Joe doing a ruthless cut of everything I wanted to tell everyone down to the punchy bits, I will try and keep to time. I'll try my very best, I promise, Joe. So, firstly, I'm a really proud learning disability nurse and mental health nurse. I've been qualified for 20 years this year. It's gone really quickly and I still every day love being a nurse. It's an absolute priority to me and to the board, the whole organisation, that people receive care that's high quality, that it's compassionate, that it's hopeful when people have lost hope themselves, that the care that we provide provides that hope. But aside from all the jargon, the terms around it, our priority is to provide care that you'd be happy for someone that you love to receive. That's it. That's the absolute, that's what we're all here for. But we can't do that if we don't look after our staff and if we don't ensure our staff are working within the conditions that enable them to deliver that care. And our new trust strategy, which Kevin mentioned earlier and other people have touched on, is real testament to that. And so I want to take and pause and take this time to just say thank you. Some of our staff are here, and many, many more aren't, but thank you to the staff, whether you're patient-facing, whether you're in clinical roles, whether you're in supporting roles to the rest of the organisation. Thank you for the role you play in making sure that people can have high quality care. Special shout out to the pharmacists, as it's National Pharmacy Day today, and I think they're often unsung clinical heroes, so I wanted to make a comment for them. They won't be here because they'll be out delivering their work, but yeah. We've had one inspection from the CQC this year over to Ash Villa in Sleaford, just down the road from here. And we're really proud that we've retained a good rating in all domains, actually, following that visit. And that's the only full inspection that we had in the last year. Our quality priorities for 23-24 had a real focus on physical health, self-injury and suicide, improving carer involvement, and on reducing restrictive practice. And as well as that, on improving patient experience. There's more detail around the quality priorities for the Trust and the detail around that within our annual quality account. But any of the quality priorities that we've not achieved as fully as we'd like or want to do more work on are in the forthcoming quality improvement priorities. And for this year, we've really challenged ourselves to set our quality improvement priorities based on what people, their families and our teams are telling us. So really trying to think about what means the most to people, which I'm really proud of. Feedback and listening to people and their families is something that's really important to us. It's also something that, even though we try really hard to get right in nearly every complaint or incident or when things go wrong, we always know we could have done more and listened differently, listened more, and really heard what people are telling us. So some of our statistics there, which we're proud of in terms of feedback. But as an organisation, we want to do more. And in 2024, we're really reviewing how we approach complaints and when people tell us things aren't going well, to involve people and their families sooner and in a more meaningful way. And also testing out new ways for people to give us feedback and to hear that positive feedback as well, which we get an awful lot of, but don't necessarily use enough to help think about how can that stop other things going wrong, how can we really build on that, which fits really well with our patient safety agenda. So across the country, you'll hear people talking about PSIRF, Patient Safety Improvement Incident Response Framework, and how people are using that across the country as a tool to think differently and learn when things go wrong. We're no different here in LPFT, so we have transitioned to using PSIRF framework, and you can see the detail of that and what our plan around patient safety is on both on our website, and we can share more detail on request. But I think one of the key things for me is we've got that all written down, but there's more to do for us as an organisation in a culture that really wants to learn, to really listen, to really think about when things have gone wrong, but also when things could have gone wrong and didn't. So when things nearly went wrong and we caught it in time, how do we learn from that? How do we do something different? And that's something that we're really challenging ourselves as an organisation on. And again, and it's a theme that most people that know me well will hear me say a lot, how can we involve people and their families sooner? How can we involve them meaningful? How can we learn from people as we go? Co-production and involvement is an absolute priority for me personally and has been through my career, but also for the organisation. And there's a few things that we're really proud of in the last year that are ongoing for us, including we're piloting with support from NHS England an Every Voice Guardian role, which is like a freedom to speak up guardian, but for patients and family members in our inpatient services. We're about to launch a Council of Lived Experience, which brings together all of the different lived experience groups across our organisation, and fits in with those quality improvement priorities for 23-24 that I mentioned earlier. Our patient partners, which is both paid and volunteer lived experience roles within the organisation, to really challenge us to think differently. And as Kevin said, we're really proud that we won a national award for that yesterday. And their work included telling us the food wasn't good enough. So, and challenging the board, if you really want to know what it's like, come out and eat with us, come and tell us if you'd want this for your dinner. So we did. So all the members of the board that are here today have been part of that programme. and there's many other programmes as well, and I'll get distracted and tell you all about them, and then Joe will be flapping at me at the back, so I won't go into it. But we know we've still got more to do in this space. So although it's a priority, although I'm telling you about the National Award, we know we've got more to do. And I want to take a moment to again just say thank you for the input from that, but also from the board colleagues. It could be really easy to think that that's the Director of Nursing's job to listen and to come and do some of that. But I know that every individual member of our board takes that seriously and cares and wants to champion that. And I want to take the opportunity to tell you guys that. One of the areas I want to do more on in that space is the seldom heard voices, the voices that are harder to hear, people with a learning disability, people with dementia, people that are quieter, wouldn't feel as confident to speak up, might be frightened to, because we have a lot of power over them in terms of the responsibility that we hold and the care we deliver. And I take my responsibility as Chief Nursing Officer for LPFT really seriously, to prioritise people, to learn, to improve, and so that just because you've got a mental health problem, a learning disability, dementia, or you're autistic, you're not seen as less. And that's something that I hold really true, and I know that many others of you do here as well. So I'll close as I start to say thank you for people using our services, people using our services and people providing our services in making sure that we can help people to live well in their communities and continue to learn and do better. Happy to take any feedback, either in here or outside, around what you'd like to hear from my role in future APMs, but also any questions before I hand over. Okay, in that case, I'm handing over virtually to a video for Mark, our Chief Finance Officer, but also I know John, our Associate Director of Finance, coming up in case anyone's got any questions. Thank you, everyone.
Great, thanks, Joe.
So good morning everyone, I'm Mark Platts, I'm the Trust's Chief Finance Officer, and apologies I'm not there with you today. I was genuinely gutted with the clash of dates. I was really looking forward to getting back together with the annual public meeting being face to face, but I do know that John Knowles, our Associate Director of Finance, is there with you this morning to take any questions that come up during the session, so apologies again. I'm now just going to talk through a summary of the financial year, just picking up on a couple of the key highlights to note for us at today's event. So we have met our financial surplus plan that we planned for the year, and I will go into that in a little bit more detail. So that's a positive. A really, really important one for us this year is the continued eradication of our dormitory ward schemes. So really positive with Ellis and Castle coming online in Lincoln, and great to see groundbreaking and us laying our first bricks in Norton Lee. So really positive position for us on that one. We also continue to work with the Integrated Care Board to maximise the use of the Mental Health Investment Standard. This is a really important standard for protecting investment in mental health services in Lincolnshire. So really important that we maintain focus on that one. However, we do need to flag as part of my update that whilst we have met our financial surpluses and our positions that we planned for this year, we were reliant again on a number of one-off savings during the year. So these won't be there in future. So it's really important that we do make sure we focus on getting the best use out of our resources moving forward so that we can continue to operate sustainable services. In terms of our key financial headlines, our operating surplus was just shy of £9 million. This was significantly higher than planned and was part of a number of agreements with the Integrated Care Board and wider system around how we can support the Lincolnshire financial position whilst maintaining the best quality of service provision for our patients during the year. So there are a number of one-off income streams within that the Trust has received that we didn't actually spend last year. So it's important to note that that won't be there next year in terms of our surplus position. As you can see from our non-current asset base and capital expenditure figures, these remain high in increasing numbers, and these reflect the addition of Ellis and Castle Ward in Lincoln and the ongoing work on Norton Lee, where we're investing on our estate moving forward. So great to see those coming online. In terms of our cash balance, this again was higher than planned at £50 million, and the significant jump from last year is driven by A, our financial surplus, and B, as receiving the cash funding for our capital schemes over at Norton Lee, ready for this financial year's delivery. So a really quick summary of our financial position there. In terms of moving forward into 24-25, there are a number of key areas that we need to keep our focus on during the next 12 months. And the first one of those is ensuring that we have that system-wide ownership and delivery of the mental health investment standard, making sure that we can continue to invest in new services. And it's also important, really important for me, as it will be for all of us, that we balance that out with the investment requirements around our dementia, learning disabilities and autism service. So we really need to look at all of the services that we provide as a trust, working with the system to maximise that investment where we can. I've touched on the really positive capital investment that we've had with Ellison Castle, and it's really exciting to see the Norton Lee scheme grow and come out of the ground. It's also really important for us to drive to deliver sustainable services in the future. So as I mentioned with our financial position, there were a number of one-offs in there that won't be there in the future. So it's really important that we make sure that the services that we deliver are cost effective as well as providing a high quality of service to our patients. In terms of operating as an integrated care system, delivering system-wide financial sustainability is really important. So for this financial year that we're currently in, 24-25, the Lincolnshire system did plan a break-even position. So it's important that we support the organisation, the system, alongside NHS England nationally to make sure that we can get the best value for our financial resources that we can and deliver that planned break-even position, whilst maintaining the best quality clinical services that we can. Alongside that, we need to continue to effectively plan and support our capital investment in Lincolnshire. So, we've had some great successes with the eradication of dormitory schemes alongside our acute colleagues with schemes along their emergency department and areas and such like that. So it's important that we continue to work as a system to prioritise where our capital is needed, given the ageing of some of our estate as LPFT as much as those in system partners. So a really important area for us to focus on this year. Another really important element for us to succeed in the future is to continue to collaborate. So we are continuing to partner with a number of system-wide colleagues, whether that be the Integrated Care Board or other organisations, the voluntary sector, to look at how do we further improve and enhance our digital workforce and service redesign offers, and how can we make sure that we get the best use out of our resources to deliver patient care in the right way. And as I've touched on previously, we're also continuing to make sure that we can deliver the mental health, dementia, learning disabilities and autism alliance objectives this year, and work together collaboratively to move forward into a brighter 24-25 where we have high quality patient care and a financially sustainable organisation. So apologies again for not being there today. I'm sure John will be willing to answer any questions that may come up in the session, and I look forward to seeing you all face to face next year.
Thanks, Joe. So yeah, happy to take any questions now or after the event if anyone's got any. And if not, I'll hand back over to Kevin. Thanks, everyone.
And with a single bound, he was free. That brings us to a conclusion of the annual public meeting section of this morning. I just want to say thank you to exec colleagues for presenting so compellingly the progress that we've made over the last year. But more than anything, I want to say thank you to the Trust staff. So if it wasn't for the contribution that everybody in the organisation has made, we'd have no progress to present at all. So on that, if there are no questions or comments anyone would like to make, that brings the annual public meeting section of this morning to a conclusion. And I'd like to hand over to Rebecca Metso, the acting lead governor, to take us into the annual members meeting. Rebecca.
Good morning, everyone. I'm Rebecca Metso, and I've been with the Trust. I've been with Service User Governor, with the Trust since August 2020. I was elected as Deputy Lead Governor with effect from January 2022, and in June this year I was asked to act up as the lead governor role until such a time an election process is undertaken. During my time as a governor, I have sat on a number of staff recruitment panels, been the governor representative on the Trust's cost improvement panel, and as well as represented service users at various meetings and events. It's my job today to tell you about the work of the governors. The governors are all members of the Trust and all volunteer their time. The service user carer, public, staff governors are all elected from the membership of the Trust. We also have some governors appointed by the organisation who work most closely with the Trust to deliver care for people with mental health and or learning disability needs. Governors have two main duties. One is to represent the membership and the wider public. The other is to hold the Board of Directors to account for the performance of the Trust via the non-executive directors. To ensure we carry out our duties, the two duties I've just mentioned, governors attend a Council of Governors meeting, where those duties form the most important parts of the agenda. As well as doing this, the governors give their views to the Trust to ensure that all the needs of the public are included in the Trust's strategic plans. We are given the opportunity to read and comment on the Trust's annual report and accounts so that we can understand where the Trust is doing well and challenge areas of underperformance. Quality is an important part of what the Trust does, and as governors, we agree the Trust priorities and review the annual quality report. As a Council of Governors, it is our responsibility to award the contract for the external auditors. During the year, governors were involved in the selection process for new non-executive director, associate director, and in line with governors' responsibility to appoint these positions. The Council of Governors also approved a recommendation to reappoint the Trust Chair and two non-executive directors for a second term of office. As the only foundation trust within Lincolnshire Integrated Care System, it is vital that in our role as governors, we do our very best to represent the views of the people of Lincolnshire. A moment ago, I mentioned that one of the Council of Governors' responsibilities is to represent its members. Anyone can be a member of the Trust, and joining is easy. People just need a simple application form. For those of you who are members, thank you. And for those of you who aren't, please sign up today. You'll find Sam Swindell, and she's our Governor and Membership Officer, and she's where the tea and cakes are, so it's a good place to go. If you have friends, then please ask them to join, and the form can be found on the Trust's website. On the 31st of March 2024, there were 9,380 members, and we continue to recruit new members. So please do ask your family and friends to join as the members of the Trust. Since the COVID-19 pandemic, governors have increased opportunity to be able to meet the Trust members again. However, we do continue to engage with them in both written and electronic material. Governors have been able to engage with members of the at public events and a range of groups and committees that are run by the Trust and other organisations. Visits to services provide the opportunity to meet service users in a variety of settings. This year, we are engaging with members by holding today's public meeting and members meeting, and I'm pleased that the Trust has made the decision to return to holding this event in person, providing the opportunity for us and not only to have helpful conversations, but also the Trust to showcase many of its services. We have held all our Council of Governors our council meetings in public and published all our meeting agenda, papers and minutes. These meetings have been held using technology which allow members and the public to observe these in real time. The meetings are also recorded, which enables anyone to view them via the website. We did hold our first in-person council meeting in July since COVID-19, and consideration is being given regarding how future meetings will be held. We will now be producing one printed Better Together magazine during the year, and in between times we'll produce 3 electronic versions of this. Both are always available via the website. As governors, we want to hear about innovations and ideas that members of the Trust and public can give us to help us to contribute to the Trust's future plans to make services better in a co-produced approach of inclusion. The feedback you give enables us as governors to influence key decision makers, both within the Trust and in the Lincolnshire Integrated Care System. Sometimes where issues relate to individuals, we can direct concerns to the appropriate service and help produce immediate improvements. You've heard from the directors about the Trust quality and financial performance. As a Council of Governors, we regularly receive reports through a variety of routes, and we hold the board to account, as mentioned earlier, by the non-executive directors, who provide assurance reports to every Council of Governors meeting. Governors have the opportunity to directly contribute to the Trust's agreed quality targets and are particularly keen to review the Trust's progress against the Care Quality Commission outcomes. I would like to take this opportunity to thank you on behalf of myself and my fellow governors for joining us today and support the continued work of the Trust. I'm now going to hand over to Karen Scott, Trust Secretary, who will provide you with the facts and figures around our membership and the requirements of the Constitution. Thank you for listening.
Thank you, Rebecca. Good morning, everybody. As Rebecca said, I'm Karen Scott and I'm the Trust Secretary at LPFT. It's my role today to provide you with some facts and figures regarding the Trust membership during 23-24, and also give you some information regarding the governor elections that were held during that reporting period, and importantly, the results of those that were carried out more recently this summer. So, changes to the Constitution. As the slide indicates, during the time that the Trust carried out a well-led self-assessment, a decision was taken to just carry out an interim review of the Constitution, bearing in mind that well-led self-assessment may lead to some further required changes. As well as a number of factual updates being made, the decision made by the governors and directors to reintroduce a partnership governor representative from Lincolnshire Police was also provided for within the Constitution. Later this year, a more comprehensive review of the Constitution will be carried out, and we'll be setting up a working party with governors to go through that, and it will also be in consultation with the Board of Directors. In terms of our membership constituencies, the slide sets out those 4 constituencies, 3 of which actually represent our members. Currently we have 28 governors in post, and in a later slide I will confirm which seats remain vacant. In terms of membership, Rebecca touched on this, but this slide sets out the membership by constituency as at 31st of March 2024 compared to the same time the year previously. As illustrated, there was a slight dip in the number of public and service user carer members over the year. However, the total number of members went up slightly due to an increase in the number of staff following that fantastic work that was carried out. As Rebecca has just said, we continue to recruit to our membership, And again, I'm going to say, I'd encourage you, if you're not already a member, to please consider signing up today and encouraging your family and friends to do so too. There are benefits of being a member. They're quite broad-ranging, and you can choose to simply receive information about the Trust's activities, or you can become much more involved and express your views on how the Trust could potentially improve its services. Our membership statistics tell us that women continue to be overrepresented, and this has been the position since we gained Foundation Trust back in 2007. Our membership strategy does contain plans, and continual efforts are being made to try to ensure that that membership is as representative as the population that we serve. So, in terms of the elections carried out during 23-24, staff general elections were carried out, and successful candidates took up their 3-year terms from the 1st of October 2023. By-elections were also held for a number of vacant seats, and whilst 3 seats were successfully filled, unfortunately we had a number that were not. In a moment, I will be announcing the results of this year's elections, and I'll highlight the seats that remain vacant. And again, a plea, if anybody here today is interested in becoming a governor, whether it's for a seat that remains vacant or in the future, please do take the opportunity to speak to Samantha Swindell, our Governor and Membership Officer, or Rebecca as our Acting Lead Governor, and other governors that are here today who can give you their personal experiences of being a governor. Following a by-election this year, we continue to have 3 unfilled service user seats, 1 young people carer seat and 1 general carer seat. Recently, 2 of our staff governors resigned, and I would like to extend thanks to Dan Fleshbourne and Debbie Judge. Prior to being successfully employed by the Trust, Dan had been one of our carer governors, and during his time in both seats for some significant period of time, his contribution was fantastic to the work of the council. Debbie has also been a staff governor on the council on 2 separate occasions, and again we thank her for her time. This is service in a voluntary capacity in addition to their substantive and busy day jobs. Whilst Dan's seat in the Adult Community Services Division has been taken up by Alan Gerbert, and I'm really pleased to see Alan here today. Welcome back to the Council of Governors, Alan. We do currently have a vacancy within the Adult Inpatient Services Division. Elections for public governors were held this year, and successful governors will take up their seats for 3 years with effect from the 1st of October next week. There were 2 governors who decided not to restand in these elections, Marlene Forward and Alexandra Chambers, and we would like to thank them for their contributions during their time as governors and wish them well for the future. So, the moment of truth, the results of the public elections. There were 4 uncontested seats, and the constituencies were East Lindsey. Emma Slack was re-elected for her 2nd term. In West Lindsey, David Docherty has been re-elected for his 3rd term. In North Kesteven, Carol Hagan has been re-elected for her 2nd term. And in South Holland, Jonathan Sibley has been re-elected for his 2nd term. There was 1 contested seat, and that was in South Kesteven. There were 3 candidates that stood. Debbie Abrahams, however, was re-elected for her 3rd and final term. I'm really delighted with those results. Congratulations to everyone on their successful re-election. Thank you for choosing, thank you for choosing to restand, and we really look forward to continuing to work with you. Thank you too to those members of the public who stood in the contested South Kesteven constituency. We hope that you will continue to show an interest in the Trust and its activities. There were no candidates for the City of Lincoln, Borough of Boston, or the rest of England seats, and unfortunately, therefore, these are now vacant. Finally, On behalf of the Trust Board of Directors, I would like to thank governors for their ongoing support of the Trust's work and contribution to its further development. Long may it continue, and you keep up the good work. Thank you very much. Happy to take questions. No? No questions? Thank you. I'll hand it back to Kevin.
Thank you, Karen. Thank you, Rebecca. Just a couple of final closing comments from me. The first is just to echo what Karen and Rebecca have said. The fact that we're a foundation trust and therefore have members and a council of governors is an inestimable strength for us. We're much better for it. So as both Rebecca and Karen have said, if you want to become a member or a governor, then I would absolutely encourage you to do so. You're invaluable. So thank you very much. If there aren't any more questions, we're just about done. I'd like to do a couple of quick thank yous. Loads of people have been involved in today and getting this event to be as good as it is. People on the stands. Karen's had a role, not surprisingly, as Trust Secretary. But there are a couple of people I'd particularly like to say thank you for, because it's been as other people have observed, been some time since we've done it this way, and I think this morning's been absolutely fantastic. So I'd particularly like to say thank you to Amy Poole and to Joe Walker. Thank you very much, both of you, and all of the other people that have been involved. That's it. We're done. The stalls are still there, and there's coffee and cake and all sorts of other things probably. So if you've not had a look at all the stands, then please go and do so. And enjoy the refreshments as well. Thank you very much, everybody.
Just a reminder, our next presentations are about the service developments, and they'll start at 11:35 with Steve Skinner from our Adult Community Mental Health Transformation. So have a break, have a look around the stalls, but please do come back for the service developments presentations too. Thank you.